Secretary Kennedy demanded that you blindly rubber stamp his future vaccine decisions. When you pushed back on Secretary Kennedy's demands, how did he react?
He was very upset. The entire meeting was very tense. He was very upset throughout the entirety of our discussion, and it was not a productive exchange of information.
What was the Secretary's reaction when you raised the need to consult scientific evidence before making decisions?
This is when he stated that CDC had not collected the data or the science. There was no scientific evidence associated with these vaccines. He made another set of assertions associated with CDC that were particularly pointed and particularly hurtful and disparaging. He called, in that context, CDC the most corrupt federal agency in the world, emphasized that CD employees were horrible people. He said that CDC employees were killing children and they don't care. He said that CDC employees were bought by the pharmaceutical industry.
And it is fair to say, in your view, that those statements are not true.
Those statements are not true.
Thank you. What was the Secretary's temperament as you pushed back?
He was very upset with me. He was extremely animated towards me in that room. The Secretary was clear in the two things that he was demanding of me, demanding to fire those scientists and demanding of the pre-approval of the vaccine recommendations.
Dr. Monarez, during your confirmation process, I was frankly unsure about whether you would stand up to Secretary Kennedy. Thank you for standing up to Secretary Kennedy and again for being here today. During your confirmation hearing, Dr. Monarez, I asked you whether you would follow the law or follow orders that would violate the law, and you said that you did not believe that you would be asked to break the law. In your testimony, you say that you were asked to take actions that violated your oath of office, which is an oath to support and defend the Constitution and to well and faithfully discharge the duties of the office. What directive did you receive that would have violated your oath of office?
It was actually the latter part that concerned me.
Yeah.
Well and dutifully execute the functions of the office and being asked to compromise scientific integrity associated with those decisions and to fire individuals without cause gave me pause about that particular phrase.
Yeah. Is it fair to say that one of the ways you could describe your duties of the office is to protect the health of families and children by making sure you adhere to science?
That's exactly right.
Thank you. Doctor, as you've shared today, Secretary Kennedy demanded that you blindly rubber stamp his future vaccine decisions. When you pushed back on Secretary Kennedy's demands, how did he react?
He was very upset. The entire meeting was very tense. He was very upset throughout the entirety of our discussion, and it was not a productive exchange of information.
What was the Secretary's reaction when you raised the need to consult scientific evidence before making decisions?
I'm sorry, what was that?
What was the Secretary's reaction when you raised the need to consult scientific evidence before making decisions?
Yeah, it was, this is when he stated that CDC had not collected the data or the science. There was no scientific evidence associated with these vaccines. He said that CDC had failed in its duties to be able to appropriately evaluate the safety, the efficacy, never had conducted controlled clinical trials, placebo-controlled clinical trials associated with the vaccines. He made another set of assertions associated with CDC that were particularly pointed and particularly hurtful and disparaging. He called, in that context, CDC the most corrupt federal agency in the world, emphasized that CD employees were horrible people. He had said that,
Yeah.
I'm sorry. He said that CDC employees were killing children and they don't care. He said that CDC employees were bought by the pharmaceutical industry. He said CDC forced people to wear masks and social distance like a dictatorship. And the one I think that hurt me the most was a particularly vivid phrase he said during the COVID outbreak. CDC told hospitals to turn away sick COVID patients until they had blue lips before allowing them to get treatment.
And it is fair to say, in your view, that those statements are not true.
Those statements are not true.
Thank you. What was the secretary's temperament as you pushed back?
He was very upset with me. The temperament was similar to the times under duress during the Senate Finance Committee hearing, if that is helpful. He was extremely animated towards me in that room.
Was the secretary's thinking and reasoning clear to you during those meetings?
The secretary was clear in the two things that he was demanding of me, demanding to fire those scientists and demanding of the pre-approval of the vaccine recommendations. Some of the things that he was talking about were clearly not aligned with the scientific evidence that I knew related to safety and efficacy and placebo-controlled trials. And the conversation seemed to change points very quickly. Okay. It was hard sometimes to follow the logic that he was putting forward. And again, he was very, very upset and very animated.
Thank you. And Mr. Chair, if I could, I have a yes or no question, and then we will be done. You said that the secretary spoke at length about the CDC. During that time, did he ever express condolences for the police officer who was killed during the recent shooting at the CDC or the 2 children who died of measles this year?
During that meeting, no.
Thank you. Thank you, Mr. Chair.
First, I just want to understand how unprecedented this moment is and how unprecedented these changes are that are compromising our families and our kids' safety. Just some simple yes and no questions. I think they're yes and no questions. Dr. Monarez, is there any precedent for a new administration dismissing the entirety of the Vaccine Advisory Board and appointing a totally new board?
I have not had any awareness of that happening previously.
Is there any precedent for the CDC director being required to clear personnel and policy decisions with political staff in the way that you were requested?
That has never been my experience.
And is there any precedent for a CDC director to be asked to pre-approve vaccine recommendations without ever having actually seen the recommendations themselves or the medical and scientific evidence backing them up?
I have never experienced that.
You stated in a previous answer to a question that during your August 25th meeting, the secretary referenced that he had spoken to President Trump about his feelings about the childhood vaccine schedule. You testified that he had previewed for you that there were going to be some significant changes coming. Did he give you the impression that the president supported the changes that he was going to be pushing on the child vaccine schedule?
That was the impression that I got. I have no way to substantiate whether the veracity of that.
Your op-ed opens with a harrowing account of the August 8th shooting, and clearly both you, the entire leadership, and the entire building is still reeling from that moment. 180 rounds being fired into the CDC. What a traumatizing event. I want to ask you about your fears, and Dr. Rory, be glad to hear your thoughts as well, for the safety of our personnel at the CDC and the medical profession writ large. If more and more people believe that those that are recommending vaccines for our children and our families are hurting people, Clearly, you have to be unhinged to take a gun and fire it into a medical building. But these conspiracy theories about vaccines and about the people who are recommending vaccines, I fear they come with consequences. Do you fear for the safety of the CDC and of medical personnel if these beliefs about the CDC actually recommending things that hurt people continue to become mainstream?
I do worry about that. I myself was subject to threats, and I am very concerned that the further promulgation of misleading information will undermine not just the safety and health of our children, but it will also exacerbate some of these tensions, the willingness to commit harm if someone is affronted by a belief that the people like us that are trying to help them are actually not trying to help them.
And I would just say it was 500 rounds. It was 180 that hit the building.
180 hit the building.
Now, each bullet was meant for a person. And each of my staff were very traumatized afterwards. I had staff that were covering their kids in the daycare parking lot. There were people that were out at the ride share as bullets were passing over their head. I have many that won't speak about vaccines now and have removed their names off of papers. They don't wish to present publicly anymore because they feel they were personally targeted because of misinformation.
So you know of personnel who now will not put their name behind good science.
Correct.
That they know would protect the health and safety of families and children because of their fear of violence.
Correct. And even at the ACIP meeting, you'll notice we don't have our subject matter experts presenting anymore. It's taken up to a leadership level because we did that to protect our staff and scientists so that they would be disconnected and their names not associated so that they won't be targeted.
Thank you both for your candor today and your service to the country.